Bandaging. A bandage is any material that is used to wrap or cover any part of the body. Bandages are used to hold dressings in place, to apply pressure to control bleeding, to protect a wound from dirt and infection, and to provide support to an injured limb or body part. Any bandage applied snugly to create pressure on a wound or an injury is called a pressure bandage. Bandages are of different types. Adhesive compresses, which are available in assorted sizes, and consist of a small pad of non-stick gauze on a strip of adhesive tape that is applied directly to minor wounds. Bandage compresses, which are thick gauze dressings attached to a bandage that is tied in place. Bandage compresses are specially designed to help control severe bleeding and usually come in sterile packages. Roller bandages, which are usually made of gauze or gauze-like material. A roller bandage generally is wrapped around the body part. It can be tied or taped in place. A roller bandage also may be used to hold a dressing in place, secure a splint or control external bleeding. Elastic roller bandages, sometimes called elastic wraps, are designed to keep continuous pressure on the body part. Triangular bandage is a piece of cloth cut into a triangle that can be used as a sling and to cover large areas. Folded into a cravat, it can be used just like a roller bandage. General bandaging guidelines. Use a dressing that is large enough to extend at least 1 inch beyond the edge of the wound. If body tissue or organs are exposed, cover the wound with a dressing that will not stick, such as plastic wrap or moistened gauze. Then secure the dressing with a bandage or adhesive tapes. If the bandage is over a joint, splint and makes a bulky dressing, so the joint remains immobilized. If there is no movement of a wound over the joint, there should be improved healing and reduced scarring. Check for a feeling, warmth and color in the area below the injury site. Observe fingers and toes before and after applying the bandage. A bandage should be snug, but not so tight as to interfere with circulation, either at the time of application or later if swelling occurs. Do not cover fingers or toes. By keeping these parts uncovered, you will be able to see if the bandage is too tight. If fingers or toes feel cool to the touch, or seem to look pale or blue, the bandage may be too tight and should be loosened slightly. Apply additional dressings and a supplementary bandage if blood soaks through the first covering. Do not remove the blood-soaked bandages and dressings. Disturbing them may disrupt the formation of a clot and restart the bleeding. Bandaging techniques depends upon size and location of the wound. Your first aid skills. Materials at hand. A square knot, or reef knot, is used to tie the ends of a triangular bandage. It is easy and quick to tie and untie. It is formed by tying a left-handed overhand knot, and then a right-handed overhand knot, or vice versa. A common mnemonic for this procedure is right over left, left over right, makes a knot both tidy and tight. Folding a triangular bandage into a cravat. Bring the point, or apex of the triangular bandage, to the middle of the base. Then fold lengthwise along the middle. To make it narrower, fold it again until you obtain the desired width. Top of head. 1. Fold a hem about 2 inches wide along the base. 2. Put the bandage in place with the hem on the outside. Place the bandage on the head, so that the middle of the base lies on the forehead, close down to the eyebrows, and the point hangs down the back. 3. Carry the 2 ends around the head above the ears, and cross. Do not tie them, just below the bump of the back of the head. 4. Draw the ends snugly, carry them around the head, and tie them in the center of the forehead. Five. Steady the head with one hand, and with the other draw the point down firmly behind, to hold the compress securely against the head. 6. Pick up the point, and tuck it in, where the bandage ends cross. Forehead or eye. 1. Place the center of the cravat over the dressing that covers the wound. 2. Carry the ends around to the opposite of the head, and cross them. 3. Bring them back to the starting point, and tie them. Ear, cheek, or jaw. 1. Use a wide cravat. Start with middle of the cravat over the dressing that covers the cheek or ear. 2. Carry one end over the top of the head, and the other under the chin. 3. Cross the ends at the opposite side, bringing the short end back around the forehead, and the long end around the back of the head. 4. Tie them over the dressing. 5. Never use the method for fracture of the jaw, or where there is bleeding in the mouth, or danger of vomiting. Shoulder. 1. Using a wide cravat, place a third of its length on the dressing, with the short end towards the front. 2. Carry the other end passing down the armpit, and back to the shoulder, crossing the short end, and covering the dressing. 3. Continue bringing the same end around the back, then the other armpit, and back to the front where it is tied with the short end. Arm or leg. 1. With a cravat, place it diagonally along the arm or leg, with a third of its length on the dressing. The short end should be towards the upper part. 2. Starting below the dressing, wrap the other end around the arm or leg, with overlapping spiral turns upward until it covers the dressing, and the end reaches the short end. Three. Fold the short end back, and wrap it around the extremity, to reverse its direction opposite that of the other end. 4. Tie the ends with square knot. Chest. 1. Place the center of the bandage on the dressing, with the point resting on the shoulder as the side of the injured chest, and its base parallel to the ground. 2. Fold a hem about 2 inches outward, along the base, then carry both ends firmly around the body, and tie them at the back. Three. Twist both ends together, and bring them up to the shoulder where the point is, and tie them as well. 4. Be sure to fold outside hems at each side of the bandage, before tying the point. Pump. 1. Place the center of the cravat over the dressing. The pump should be facing upward. 2. Starting with the end on the thumb side of the hand, carry this end under and around the hand, passing on the wrist side of the other end, and back to same side where it started, close to the thumb. 3. Carry the other end under and around the hand twice. The first wrap passing behind the thumb, and the second one between the thumb and the first end. Four. Cross both ends at the wrist and tie them.